Hello everyone and welcome back to Medi Notes for Medicos. I know it's been a long time since we have met each other on YouTube. I was busy with some of my personal works. However, let's dive into our topic. The topic that we're going to deal today is Introduction to General Pharmacology. Now, this is a very basic thing that we all need to know while you're dealing with pharmacology, because if you don't understand this aspect, it becomes very difficult for you to know how does a drug work in the body. So many of the second year students were asking me how to study this, so I thought why not start from the basic. Okay, so today we'll be dealing with introduction to pharmacokinetics, components of pharmacokinetics, primary pharmacokinetics, parameters. Now this would be a basic overview. We'll go into more details in the further videos. So let's dive into the topic without any further ado. So when you see the word pharmacokinetics over here, let's split this word, okay? So when you see this word pharmacokinetics, we can split it into pharma and kinetics, okay? Now, what does the word pharma mean? Pharma mean drugs. And kinetics, we have studied it earlier, it means movement of the drugs. So can we say that the movement of the drug inside the body is known as pharmacokinetics? Yes. So what a body does to the drug once it's consumed is known as the pharmacokinetics. Now there are certain components of pharmacokinetics. We also call this as ADME study. Okay, there are four components basically. In these four components, we are going to see the first one, where A stands for absorption of the drug. So what happens in this? Suppose we take a drug orally. So once we consume the drug orally, it passes through the GIT tract into our small intestine. Okay, it goes over the small intestine once we consume it, right? So once we consume it, it goes to the small intestine. There it crosses the cellular barriers. And when it crosses the cellular barriers, this is known as the absorption of the drug. Why? Because it's going into it's crossing the cellular barrier and going into the cells. So from the cells, it goes to the blood. Okay, now this blood, it circulates via circulation and reaches the heart. Okay, suppose this is the heart over here, it reaches the heart. Now what is the function of heart? Heart pumps blood, right? So when the heart starts pumping blood, it pumps the blood that consists drug and it distributes all over the other organs. So this is the distribution of the drug process. So we studied about absorption of the drug, then the distribution of the drug. Next, what happens? Next, the blood pumped by the heart firstly is delivered to the liver. Okay. Now what does liver do? Liver, they convert the lipid soluble drugs into water soluble drugs. So that process is known as the metabolism of the drug. Okay, so why is there a necessity to convert a lipid soluble drug into water soluble drug? Because it's easy for excretion. So what is the next thing that happens? Excretion of the drugs via water soluble. Because of the conversion of water soluble drugs, the excretion of the drugs occurs. The most common route would be what then? Urine. Okay, now there is a terminology known as elimination of the drug. That is nothing but when the metabolism of the drug and excretion of the drug together is combined, that is known as whole procedure. The procedure of metabolism and the excretion of the drug in whole is known as the elimination of the drug. So let's deal with the primary pharmacokinetics parameters. So this is known as primary because based on this we can evaluate the half-life of the drug and other further parameters. So the first one we would be dealing with bioavailability of the drug, the volume of the distribution and the clearance capacity of the drug. So over here, let me take you back to the next. So in this study, like I said, that we consume the oral medicine, for example. So if I have prescribed, suppose 150 mg of the medicine, and when it is consumed and it crosses the cellular barriers and goes into the blood, that is after the absorption, the amount of drug reduces to 75 milligrams supposedly. So what happens over here? That is known as the bioavailability of the drug. So the total amount of the drug that can be absorbed by the blood or into the blood circulation is known as the bioavailability of the drug. Now volume of the distribution means the volume of the drug that can be available in the plasma, that can be distributed in the plasma, is known as the volume of distribution. Then we have the clearance capacity. So the capacity of the drug, the capacity of the drug to get cleared or excreted from the body, the total amount of excreted drug from the body or cleared drug from the body is known as the clearance capacity. So that's all for today. I hope you like this video, and we'll be coming with more videos. I'll be attaching the further detailed version of each of these phases like absorption, distribution, metabolism, and excretion in the upcoming videos. So stay tuned and keep on studying. This is Dr. Ashna V Raju signing off.